the newer program that we use, the IEF, or Indicia for Effective Focus, that's been really, really nice with improving our workflow. And the EHR that we utilized has a lot of limitations in regards to utilization review. And the work list that it has is not very conducive to a workflow. It doesn't help the nurse really develop one very well. It doesn't help us prioritize. It's very top to bottom. You can sort by a few different criteria, but it doesn't allow us to prioritize, which in most cases we need to. So IEF does a really nice job of allowing staff to figure out what cases they need to review first, where they need to go next. Allows us to know when patients discharge. Once our nurses got into it, started using it, seeing how it could help them and how it was really assisting their workflow, they've really bought into the program and really enjoy it. And what's been really nice too, since we were early adopters of IEF, is that MCG has been really good about, listening to our staff, what changes maybe would be helpful, what's going well, what's not going well. And they've taken that feedback and made changes to the program, and staff really has liked that too. So we've gotten to kind of not create the program, but change things up a little bit to even meet our needs more. I think, at least in some of the data I've seen, we are getting to patients an hour sooner than we would have in the past. That's some of the data that's been collected. So that's improved, like when we're getting to those patients, which is for some of our payers is important if they're Medicare, where time sensitivity is more of an issue. If we can get to cases sooner and the higher priority ones sooner, that's what we need. So IEF definitely has helped with that. I would say IEF has also, because it prioritizes, it lists our patients in a more organized fashion and gives us notifications on when things are updated and in the chart. We're saving a lot of time just from like the nurse perspective, not going back, making extra clicks, those kinds of things. So I would say that has helped time savings also. Within IEF, there's numerous columns of information, from, patient name to their date of birth to their admission diagnosis, when they came in, when they were last reviewed. One of those is also the length of stay. So it gives you an hour marking of based on when the patient arrived or was placed in a bed at the hospital. So for some of our payers that do require getting to them and reviewing them initially within a certain time period, whether that's 24, whatever it is, by looking at that length of stay column too, that can help guide us in what patients we need to see first. So I know we do look at, those that we're converting. There's specific, drop downs, areas we can select when we're completing reviews in IEF that give direction on, did we convert this patient to inpatient? Did we convert them to OBS? Did we keep their status as is? Did we send it to a physician advisor? So then based on what we select there, reports can be run off of that, and then the data can be used for reporting off and supporting the use of MCG and in our different data metrics.